should think of the lungs like a tree. There's the trunk, which is the trachea or windpipe. Then there are the branches, known as the bronchial tubes. These eventually lead to the leaves of our lung tree, or the alveoli, which is where the exchange of oxygen and carbon dioxide occurs. If any part of this tree becomes ill, the passage of oxygen from the trachea to the alveoli can become difficult. So when sudden inflammation of the bronchial tubes occurs, it's no surprise that we end up coughing and wheezing. This condition is called acute bronchitis.
Most causes of bronchitis we say are acute bronchitis, and that usually results from infection with probably 100 viruses, some related to influenza, some not related to influenza. At least 100 to 200 viruses can cause bronchitis, including the rhinovirus, which is the virus most associated with the common cold. So we say people get acute bronchitis, and asthma is another form of bronchitis. Sometimes viral infections damage the bronchial tube so that they're subject to bacterial infection. That's when we get a bacterial bronchitis.
When an infection invades the bronchial tubes, it inflames and irritates the internal membranes. They swell and thicken, which narrows and restricts the tiny airways. This can cause wheezing or shortness of breath. The inflammation also stimulates mucus production, which the body tries to expel with the most common symptom of acute bronchitis, a hacking cough.
A lot of people get sore throat, they may be achy, they may start with a running nose, and then there's either a rapid or sometimes a slower progression to involve the bronchial tubes and then the lungs, and that's when you get the cough. But a lot of people begin with, we say flu-like symptoms or upper respiratory symptoms, and then it progresses down.
Most acute bronchitis can be treated at home with the same remedies you'd use for any viral infection. Lots of rest, plenty of fluids, and doing what you can to decrease inflammation. This may include using lozenges or cough drops or any other over-the-counter cough medicines your doctor recommends.
The viral infection will run its course and a person will feel better after a week or so, but when you start developing changes in the phlegm, the sputum, when it changes color, when you start running high fevers, when you have difficulty breathing or chest pain, all of those are signs that it's progressing and probably needs either antiviral or antibacterial treatment. We now have, as people have seen, Tamiflu and a drug called Relenza. Those are the two anti-flu agents. There's a couple of others that are available that sometimes are given in combination that can treat a influenza bronchitis. We also have a wide array of antibiotics. So when you start seeing any of those signs, it's important to check in with the doctor.
Acute bronchitis is one of the most common complaints brought to a primary care physician, especially in the winter. Risk factors besides catching a cold or the flu includes exposure to air pollutants or allergens, chronic sinusitis, or lack of immunization.
We can prevent a lot of bronchitis by getting our vaccinations, particularly influenza, since that's such a common cause of bronchitis. And it's important, particularly if you have health problems, heart disease, diabetes, COPD, asthma, to get that bronchitis looked at and treated early, because you're really subject to a greater risk of pneumonia, which is a much more serious problem.
Another good form of prevention: quitting or never smoking. Smoking doesn't cause bronchitis, but smokers with acute bronchitis find it much more difficult to shake it off. Additionally, the damage smoking does to the cilia inside the lungs increases one's chances of developing chronic bronchitis. If you've suffered through acute bronchitis, you certainly don't want to advance to chronic bronchitis. I'm Dr. Mike Rosen, and you're watching the eHealth Network. See you next time.